Everybody, as we all know, vitamins and minerals are incredibly important in maintaining a healthy body. So in this video, I'm going to discuss some common vitamins and minerals that you might be missing, and a list of foods and methods to make sure that you're getting your daily doses. And really important, guys, make sure you watch till the end of the video, since every one of these vitamins and minerals are extremely important, especially the last one on the list. I'll preface, you shouldn't take any supplements without speaking to your doctor. This video is not a replacement for a visit to a doctor or hospital, but just for educational purposes only. Now, without further ado, let's get started. The first one on the list is vitamin D. Vitamin D is a fat-soluble vitamin. That means that fat is required for your body to absorb it. Vitamin D is produced when sunlight hits your skin, so countries that lack sunlight for an extended period of time are at a high risk for low vitamin D levels, or really anybody that rarely goes outside. There are some foods that have vitamin D naturally in it, and some foods are also fortified because it can be hard to obtain. Foods with vitamin D are oily fish like salmon, sardines, mackerel, and herring, red meat, liver, egg yolks, and fortified breakfast cereals and milk. Most milk is fortified, at least in certain countries, since it's a great source of calcium, and you need vitamin D to absorb calcium. The main function of vitamin D is calcium and phosphate regulation and absorption within the body. In turn, this affects the strength of your bones and teeth. It also plays an important role in keeping muscles healthy, so all that work you're putting in the gym is going to waste if you're not getting enough vitamin D. Number 2 is iron. Iron is not a vitamin, but it is a mineral that the body requires. The major purpose of iron in the body is that it's a component of hemoglobin. Hemoglobin is part of the red blood cell, and it holds onto oxygen and allows transportation of oxygen to other cells in your body. Women are at a higher risk for low iron levels because of menstruation every month. And vegetarians and vegans are also at a high risk, since the easiest way to get iron is through eating meat. Some signs and symptoms of low iron levels include extreme fatigue, weakness, pale skin, chest pain, fast heartbeat, shortness of breath, headache, dizziness, lightheadedness, cold hands and feet, brittle nails, and inflammation or soreness of the tongue. The easiest way to get lots of iron is through iron-rich foods, like meat, especially red meat, seafood, beans, legumes, dark leafy vegetables, dried foods like raisins and apricots, and iron-fortified cereals, breads, and pastas. The body absorbs iron from meat better than non-meat products, so if you are a vegan or a vegetarian, you'll want to actually increase these other foods even more to make sure that you're getting enough iron. Another important tip, especially for the vegetarians and vegans, is to eat these iron-rich foods with vitamin C-rich foods, because vitamin C helps the absorption of iron into the body. So these foods include citrus fruits, leafy greens, and really many other fruits and vegetables. Number 3 is iodine. Iodine is a crucial mineral for normal thyroid function and the production of thyroid hormones. The main complication of low iodine levels is a goiter, which is an enlargement of the thyroid gland. By the way, the thyroid gland is in the throat by the Adam's apple. When they're small, they're harmless because you don't really notice them. But if they get really big, then they can cause swallowing and breathing difficulties, hoarseness, and coughing. The oceans are naturally high in iodine, so seafood is too. Crops grown in countries near the oceans are also high in iodine, since iodine from the seas can leach into the soil, then into the crops, and then pass from the crops to the humans when we eat it. So for the most developed world, not living on an ocean, iodine is found in table salt. If you look at the run-of-the-mill table salt, it almost always says iodized. This has been a long time used tactic to avoid low iodine levels in these countries. Funny enough, I've heard that iodine deficiencies are actually increasing in the developed world due to the push and trend of these healthier salts, like Himalayan pink salt and kosher salts, which are often not iodized. So if you do use these salts, you can actually buy some that are iodized. Number 4 is magnesium. Magnesium is a mineral that's important for several functions in the human body, including nerve function and conduction, heart rate and regulation. It supports a healthy immune system, it's part of bone production, and it's also used for glucose regulation within the body and the production of energy and protein. If you have low magnesium, you might not actually feel any symptoms. It's actually estimated that almost half of Americans are not eating enough magnesium in their diet. So ensuring that the food So ensuring that the food you get does have high enough magnesium is very important. Long-term side effects may actually include insulin resistance and high blood pressure. More immediate symptoms of low magnesium levels are loss of appetite, nausea, vomiting, fatigue, weakness, numbness, tingling, muscle contractions and cramps, and heart irregularities. These issues should be addressed by a certified health professional. Food sources include whole grains, nuts, legumes, dark chocolate, and dark leafy green vegetables. And number 5 is calcium. Calcium is one of the most important minerals in the body. Not only is it pertinent for bone health, but it's similar to magnesium in that it's crucial for nerve signals and your heart to beat. So it's a tight regulator in the body, so making sure you get enough is crucial. The main concern is osteoporosis. Since the body will prioritize heart beating and nerve conduction over a strong skeleton, it will take from the skeleton first if it's lacking in the bloodstream. Some signs of low calcium levels include brittle nails, extreme fatigue, muscle aches, dental problems, and depression. Any severe conditions would affect the heart's ability to beat. Many people are deficient of calcium, so ensuring that you get enough, along with vitamin D of course, it's very crucial to one's health. Foods that have lots of calcium include dairy, which we all kind of know, boned fish, bones and bone broth, and dark leafy green vegetables. Thanks for watching. What vitamins and minerals did I miss? Leave a comment below to tell me, or if you want to see something in another video, let me know. Like, comment, subscribe for more. Stay healthy, and have yourselves a